Okay, are we up and going here, Chef AJ?
Looks good, Dr. McDougall.
All right. Well, anybody who is interested in cancer prevention and treatment, I encourage you to look at our website, drmcdougall.com, and I'd focus on the February 2015 newsletter, which tells you that the American Cancer Society has told my colleagues that a healthy diet in the direction that we are recommending should be fundamental in the treatment of people who already have cancer, not just in prevention of cancer, but as a treatment for cancer, because you can change the course of this disease. It's never too late. The body, you can squeeze some more health out of it. Stay alive a little longer, have a few more better days. And you do it with the food. Anyway, to carry on with the discussion I'm going to give you today, and when I say prevention and treatment of cancer, I really mean treatment. I was a little shy about saying treatment in the past, not the past 5 years, the past 10 years, but say 20, 30 years ago, I thought my colleagues would come get me as a quack when I talked about diet as an important part of the treatment of cancer patients. I guess I've been talking about this since, the 1980s, so it's been 40 years. Anyway, don't have to be shy anymore. The American Cancer Society, as of February 13th, 2015, they came out and told doctors that it's part of the fundamental therapy for cancer patients' diet. Anyway, I want to talk to you about, let me give you a little bit of an introduction here. Knowledge is crucial. I happen to be an assistant clinical professor at 4 medical schools. And because of that, I have access to the medical libraries, which you don't have access. If you go search out scientific articles, about half of the articles are open access. So you can read the whole article. The other half, various publishing companies make like $35 a copy. When you try and search that article, you can have it, sure, but you got to pay like $25, $35, $45 for every article. I can't afford that. I bet most of you can't either. But you want access to this information, particularly when I give you the scientific references, as I do in all of my lectures. In the bottom right-hand corner are the studies that I've been talking about. And you want to find out whether or not I'm exaggerating. Well, is that Dr. McDougall really telling the truth? That what he says is so different than what everybody else says? Could it be? Well, I may not continue being a professor at the medical schools in the future. Who knows? I have a good relationship with at least 2 of them. But there's access that you can have and that I take advantage of right now. And what I want you to look at and write this down is this website, Sci-Hub, SCI-HUB. Okay, there's the link, the email address, or the link for you to, not email address, the link that you have to go to put in your browser, sci-hub.se. And you go there and you put in the scientific article, and there it is. Voila, it appears. Basically everything ever written appears. And the people who founded this particular site, their attitude was the public needs this information and deserves it. After all, most of the research papers that they're selling were paid for by your tax dollars. Now, it's not like you're cheating these people. You paid for the research in the first place. Well, I can tell you, if you go to this website, you can get pretty much every article that I talk about and that I'm interested in. So write it down, become an expert. It's your life, your family's life, and your planet that depends upon you being well informed. And on the left-hand side, I just want to tell you, I want to go back to what I said in the introduction is, I've been through various phases of popularity of diets on how to get well and how to lose weight, et cetera. And I've been through them all pretty much. In the 1970s, when I first started, Robert Atkins, he was the number one, the Atkins diet, bacon, butter, and brie. You had to go into ketosis. You had to have virtually no carbohydrate at all, which makes you sick. And then you lose weight. Well, I wrote my first book, The McDougall Plan. It became a New York Times national bestseller. So it happens my literary agent, Mike Cohen, was also the literary agent for Robert Atkins. And it got to the point where Mr. Cohen, Mike Cohen, told me, he says, look, I handle both of you as authors, Robert Atkins and you, John McDougall, as authors. I can't sell anybody Robert Atkins. The public has moved on to what you're teaching. And I was so pleased. Yeah, that happened back in the 80s. And that was the way the pendulum swung then, was back towards a high carbohydrate diet and away from these low carb people. In about 1998, my publishers, Penguin Putnam, they came to me, my editors, and I was within the top 5% of sales of the books at Penguin Putnam. I was making a ton of money. And so they were real pleased to have me as an author, but they came to me, and with a frank discussion, a whole group of them, not just my editor, Michael Hamilton. The whole bunch of editors came to me and said, look, McDougall, we really appreciate you being one of our stable authors. And we want to keep you, but you have to change what you're writing about. Your stuff, these high carbohydrate, plant-based diets, they're passé. You got to start writing about low carb diets. And what I told my editors, I said, look, you're wrong. This could never happen. The science is absolutely clear that these low carbohydrate diets are dangerous. They make you sick, not just short term where you lose weight, but long term where you get heart disease and cancer. I said, the public's not that stupid. They'll never go for it. And then I told them, I said, I don't do this just for money, although I was making a lot of money back then from my books. I don't do this just for money. I really believe this. So I refused to change. And you know what happened? The pendulum swung. And Robert Atkins became the best kid on the block. You know how it was. And that happened in the year 2000. We were both kind of popular. And then the low carbers took over about 10 years later. And now, what's most popular? What are your friends doing? They're doing the keto diets. It's the Atkins diet. It's the Barry Sears Zone diet. It's the wheat belly diet. It's the grain brain diet. Those are the ketogenic diets that make you sick. Well, they may be popular now. The keto, of course, is the name of the game. It's what everybody's talking about, is the keto diet. Well, it puts you into ketosis. Ketosis occurs when you get sick. Even the words in the title of the books and the discussions are ketosis. It occurs when you get sick. Ketones suppress your appetite. That's how they work. But, and the thing I want you to listen to very carefully, and I do believe it, or I wouldn't be telling you this, the pendulum is swinging back. And I see it every place I look, in politics. I see it in the changing attitude about the environment and about racial issues and tolerance of people around the world. Democracy. I really see a lot of positive things in the future. And there have been times when I haven't. So let's saddle up, get excited. We're gonna win because we have truth on our side. No question about it. And our friends and relatives are suffering needlessly because they've been lied to. But this is 2023, and we're moving on. In the news, Jamie Raskin, who's the U.S. representative for Maryland's 8th congressional district since 2017. Last week, it was announced that he had diffuse large beta cell lymphoma at age 60. That wasn't his first brush with cancer. He was diagnosed as having colon cancer at age 48. Yeah, a dietary cancer. I don't think I have to go into the discussion of how diet causes colon cancer. I mean, good grief. A 7-year-old could figure it out that what you put in your intestinal tract determines whether it's healthy or sick. there's consensus around the world in the scientific community that what you eat causes colon cancer. So, he has the first dietary cancer. Now, what I want to tell you is that he has another dietary cancer. And nobody's talking about it. I don't think you'll find any other guest on Chef AJ's show or any place in the news that's talking about what causes lymphomas. They should be. I mean, this is a teaching moment for the public. They should be talking about it, but they won't. Maybe it's because it's not as common as other cancers. I mean, there are 77,000 cases in the US annually of non-Hodgkin's lymphoma. Okay, this is different than a type of lymphoma that has certain microscopic presence called Hodgkin's lymphoma. They're different under the microscope. And that's basically it. And as far as the diffuse large beta cell lymphomas, they represent about 30 to 40% of the cases. So it's just, maybe because of the popular, they're not talking about it, or maybe they haven't taken the trouble to do even a cursory look at the scientific literature, which I'm going to do for you right now. I didn't have to dig deep. This is the majority of the scientific research that I'm going to show you. And of course, you can look it up now because I gave you access to all the papers, didn't I? You wrote it down. So first of all, let's talk about the treatment of this particular lymphoma. It's done with chemotherapy. It's a regimen called R-CHOP, which represents the first letters of a group of chemotherapy agents. They're poisons. These poisons, many of them were developed during World War II as wartime gases to kill the enemy. And after World War II, these gases, because they killed animals and cells and so on, they decided this would be good to give to cancer patients. But it's been one failure after another, after another, for most cancers, not all of them. In fact, for lymphomas, there's been some positive results, and leukemias also. And testicular cancer, that's another example of how chemotherapy has really made a huge difference. But for the vast majority of cancers like colon and prostate and breast cancer, chemotherapy is a failure. Up until recently, and I have to tell you, there's a new regime that's come out. Now, I want you to look at it. I'm not settled on it yet, but for the first time, they've been able to advertise that there's a chemotherapy regime that'll cause breast cancer patients to live longer, and other cancer patients too. I'm still looking. I'm not ready to talk to you about it. I've had mixed results in the few patients I've sent under this regime. One of them they almost killed, and the other one, not sure yet. Anyway, so you go through this type of regime, and 90% of the patients who have limited disease improve. They're not cured. They have long-term benefits. Maybe long-term benefits are saying survive for a certain amount of time. With advanced disease, 60% respond to this particular chemotherapy. But the thing to note, and I want to carry this on in our conversation, is that somewhere around half the patients relapse. Even though they may succeed, you may see some benefits for the first few months, maybe a few years. Half the people relapse. And the relapses are much harder to treat. But I have to put in your mind the understanding that these people do not follow a healthy diet. They're never taught a healthy diet. And when I say never, I mean like never. Maybe 0.001% of time. They're taught in their doctor's offices that you ought to change it. Nah, I'm exaggerating. It's got to be less than that. But you get the point. They're never given the advantage of dietary therapy in terms of any cancer, much less lymphomas. Now, in 1977, the first article that caught my attention was this one. And I've asked Chef AJ to put this in your chat so that you can look at this article. So it's a little hard to get. You'd have to go through that website that I talked to you about in the beginning of this lecture to pull this article out, but you can. But I tried to make it easy for you. So I downloaded the article, and you can pick it up and and read the PDF file on it. And it's a very, very interesting article published in 1977. I bet half of you weren't even born when this article was published. And what they said in this article by Alan Cunningham is Alan Cunningham said there were two observations that suggested that overnutrition, especially protein, may be a factor in the pathogenesis. In other words, the cause of lymphomas. First, lymphomas are more common in the upper socioeconomic groups, and others with high food and protein intakes, particularly cow protein. 1977, they identified cow protein. And second, protein augmentation of experimental animals, like rats in this case, increases the number of lymphomas developed. Now, let me tell you a little bit about what Alan Cunningham wrote. Maybe you'll take the trouble to get this article from Chef AJ, and maybe you'll take the trouble to read it, but it's a couple of interesting explanations. And one of the things he says is that the high protein is part of the problem. And he talks about how when you eat a lot of protein, what happens is that protein goes into your bloodstream, and your immune system, your lymphocytes, lymphoma, lymphocytes, these are white blood cells, the lymphocytes have to deal with this protein. And they're overstimulated by all the protein that gets from the fork and spoon into the gut, through the gut wall, into the bloodstream. And now your immune system has to deal with it, and that immune system involves lymphocytes, white blood cells, and through chronic overstimulation of the lymphoid tissue, which is throughout the body. It's in every part of the body, every tissue, concentrated in the spleen and the liver. This lymphoid tissue is constantly being bombarded by all this protein from the diet. And so overstimulation causes the white blood cells to deteriorate into a situation where they no longer abide by a basic rule, which you can't go dividing anytime you want. They start multiplying at a high rate, and so you get a whole bunch of blood cells in your system that the body has a difficult time handling. A leukocytosis, in other words, you look at a smear under the microscope of your blood, and you just see a tremendous amount of white blood cells, and they're abnormal white blood cells too. So there's a protein in the food that causes chronic overstimulation of the lymphoid tissues. And then Alan Cunningham, he goes on and says, there's another example out here, and it's a lymphoma called Burkitt's lymphoma. You may recognize that name Burkitt because I talk about Dennis Burkitt a lot, because he's the fiber man. He's the man that opened my eyes back in 1971, opened my eyes as far as there is a cause of disease. Dennis Burkitt told me when he practiced in Africa, he was the head of the Ministries of Health of Uganda, overseeing 1,000 hospitals, overseeing 17 million people, overseeing, he had a chance to take care of this entire population of Uganda and Africa. Africa, who ate, by the way, the McDougall diet, a starch-based diet with fruits and vegetables. And Dennis Burkitt told me in this noontime lecture in December of 1971 at Blodgett Hospital in Grand Rapids, Michigan, he told me that he didn't see any colon cancer. He didn't see any heart disease. No, he saw one case. So one case of heart disease, and it was a judge that trained in London and went back to Uganda and had a heart attack. He saw one gallbladder disease with gallstones. One. Taking care of 10 million people over 17 years. That was it. No hemorrhoids, no varicose veins, no breast cancer, etc. And I was shocked when Dennis Burkitt opened my eyes. Well, Dennis Burkitt is famous for that, but more famous, he's for a lymphoma that he discovered called Burkitt's lymphoma. Every doctor, every medical student learns about Burkitt's lymphoma. It's common in Africa. It's common in any part of the world where people have a chronic infection with malaria. Malaria is a parasite that is transmitted by mosquitoes, gets into your bloodstream. And what happens is that the chronic overstimulation of the immune system by this parasite, malaria, causes the development of a lymphoma, which is called Burkitt's lymphoma. Okay, so kind of to catch up with me now, what we're talking about is we're talking about chronic stimulation of the system from dietary proteins, causes lymphoma in the general population. Chronic overstimulation of the immune system by the malaria parasite causes overstimulation of the immune system, the lymphoid tissue, which causes Burkitt's lymphoma. Do you see it? Do you get the picture here? You see in the graph here, per capita protein consumption and deaths from lymphoma. Each of these represents a country. You'll read about it in the article if you pick it up. He goes on and he talks about, well, it could also be viral infections. You know, that's a possibility that's discussed in this paper, possibility of viral infections. Well, let's take a look at the research, and this is the majority research. You'll work hard to find dissenting articles on what I'm going to show you right now. And it's current research. Dairy product consumption and risk of non-Hodgkin's lymphoma, meta-analysis, where they look at a whole bunch of scientific papers. And they find that the risk of non-Hodgkin's lymphoma increased by 5 to 6% for each 200 grams per day of dairy product intake. 200 grams of milk is 2/3 of a cup. Meat and non-Hodgkin's lymphoma, red meat intake and the risk of non-Hodgkin's lymphoma, another meta-analysis. So again, the meta-analysis is just taking a whole bunch of papers, and hopefully they are looked at by people who are not biased. You can run into meta-analysis that you wouldn't want to pay attention to because industry pays for this type of research also, and they can leave out whatever papers they want. But you know, I believe what I'm sharing with you are people who are, you know, good scientists and interested in giving a good summary of the scientific literature. And here's a couple of medical analyses that you can look at. And what they say is there's strong evidence that indicate the consumption of red meat and processed meat is a risk factor in the development of non-Hodgkin's lymphoma. You know, it's particularly the kind that Jamie Raskin has. So there you go. There's meat, there's dairy. And then you'll also find the contrary type of research out there, which shows you that vegetables in particular are not associated with this type of lymphoma. In fact, they're opposed to it. There's a significant risk in reduction in risk of getting non-Hodgkin's lymphoma if you eat a diet high in vegetables. Okay, the possible mechanisms involved, they go back to that 1977 paper by Alan Cunningham. In this particular article, it talks about it's due to immune suppression effects of fat animal proteins and also the lack of antioxidant properties in vegetables and fruits. Let's talk about the viruses for a minute. Viruses cause lymphoma in cattle. There's something called bovine leukemia viruses, which infect 84% of the herds, the dairy herds, and 38% of the beef herds. This is current data. You can find this with the United States Department of Agriculture, the USDA handles these figures. In other words, in the US population, there's actually the figures go up as high as 89%. 9 out of 10 herds are infected with these lymphoma and leukemia causing viruses, the cattle. And that's in the US, but there are over 20 countries, most of them European, particularly Finland led the way, that have killed all the sick cattle. They think it's important, but in the US and many other developed countries, they have ignored it completely. Industry has, the cattle industry, the dairy industry, They don't care whether you eat infected milk and infected beef. Well, the bovine leukemia virus is almost identical to the human leukemia virus. It was only in the 1980s that they had instrumentation that was allowed to tell the difference between bovine, in other words, cow, and human leukemia viruses. Otherwise, our techniques were so crude that you couldn't tell the difference. And they were anatomically, structurally, basically the same. And of course, we accept the fact that human T-cell leukemia viruses cause leukemia and lymphomas. That's something that the medical profession is quite happy with or comfortable with understanding. The implication here I want to talk to you about has to do with breast cancer. There have been multiple studies, and I've given you two references here, which show that these viruses are involved with breast cancer. In one particular study, the first one listed there is a meta-analysis, 6 of 8 studies that determined that examined breast cancer tissues and DNA found bovine leukemia viruses in the breast tissues. The other review showed the same thing. This is the majority opinion. When you look at the breast tissues, you find these viruses in women who have breast cancer. Probably men too, but of course, it's primarily a disease of women. But there are many cancers that are known to be caused by viruses, like liver cancer and cervical cancer and Kaposi sarcoma and Burkitt's. Another theory is that Burkitt's is caused by the Epstein virus, and it doesn't mean it's not also caused by malaria, but there are people who believe that it's another virus that causes Burkitt's lymphoma. All right, how do you go about treating this? Well, I want to bring up somebody who's a frequent guest on this show, which of course AJ really appreciates his talents. And that's Dr. Alan Goldhammer. He has an organization, an institution called True North. And there you go on water fasts. And they were able to get published in the British Medical Journal an article that discussed water fasting and an exclusive plant food-based diet, which happens to be the McDougall diet, without salt and sugar, in the management of stage 2A low-grade follicular lymphoma, basically the same as the diffuse beta cell. There's no reason to feel that they're any different in terms of how they act, how they respond. The same chemotherapy agents are used for both of these subtypes of lymphomas. So they've had a woman who is 42 years old who is diagnosed as having lymphoma. They put her on a 21-day fast. And the lymph nodes, which are the classic clinical sign of having lymphoma, you have these swellings, under your jawbone, in your abdomen. They reduced in size dramatically. When she left the fasting program, she went on, basically the McDougall diet without salt and sugar. And at 6 and 9 months, there's no evidence of disease. Got published in the British Medical Journal. There are some clinical trials that are going on now. And here's one out of Israel. The effect of a deep vegan diet and lifestyle changes on lymphomas. During a waiting period, this is a waiting period between the time of diagnosis and chemotherapy. And they've seen some positive results, and they're going to do a trial. They're in the process of doing a trial right now to show to show the rest of the world whether or not it makes a difference. But as I told you, I started this lecture in February of 2015, the American Cancer Society came out and told doctors that a good diet needs to be part of cancer therapy. including lymphomas and colon cancer and breast cancer and melanomas and prostate cancer. The evidence is sufficient to recommend a diet that does no harm, cuts your food bill by 80%, helps the environment, makes you smell better, and gives you a good bowel movement. There's no reason not to do this, except it detracts from the ability to make money. You have to talk to people. So that's my brief introduction to Jamie Raskin's present problems, which affect 77,000 people in the US every year. They get lymphomas. You know, half the population will have a major organ cancer before they die because of the diet. And people who are unfortunate enough to be diagnosed with cancer, you shouldn't stop there. And it's not just prevention. It also involves treatment. As I talked about, you may get remission from CHOP, from the chemotherapy agents, but half of them come back. Well, what if you took these people, you gave them the chemotherapy, which, shows some clinical benefits, and you put them on a good diet at the same time? What do you think would happen? I'll tell you what I think would happen is there'd be many fewer people who develop the cancer again. There are many fewer cases where the cancer come back. If we put them on a good diet, we gave them a chance of their own immune system fighting things off. But that step is one that's not been taken yet. But it's going to be, because the future is going to be different. We're going to get the truth out, make a difference, change the world. That's what I believe.